Welcome back to my YouTube channel. If you are new to my channel, welcome to Medcode Insight. Hi, I am Nishava, a certified medical coder. Today we will discuss debridement, a very important topic within the integumentary system. So without further delay, let's get started. Debridement is the process of removing dead skin and foreign material from a wound to reduce the risk of infection and promote healing. In the CPT coding system, there are four types of debridement codes. First one is for the infected skin debridement based on the percentage of the body surface affected. Second is soft tissue infection debridement specific to the soft tissue infection. The third debridement is for the open fracture and or dislocation. This code pertains to the removal of foreign material at the site of an open fracture and or open dislocation. The fourth debridement based on depth and surface area. It is measured in square centimeter. Codes 11,000 and 11,001 are used for debridement of the dead tissue in the skin based on the percentage of the body surface involved. 11,000 is for initial 10% of the body surface area. 11,001 is an add-on code used for each additional 10% of the body surface area. Codes 11,004 to 11,006 are used for debridement of soft tissue infections and are based on the location. 11,004 is for extragenitalia and perineum. 11,005 is for abdominal wall. In 11,006, there are all three locations mentioned above: extragenitalia, perineum, and abdominal wall. There is an add-on code 11,008 which is used for the removal of prosthetic material or mesh, which is from the abdominal wall, as a part of treating an infection. It is performed during the same session as a separately reportable debridement or incision and drainage procedure. Codes 11,010 to 11,012 are used for the removal of necrotic tissue and all foreign material at the site of an open fracture and dislocation. Code 11,010 involves debridement of the skin and subcutaneous tissue. Code 11,011 involves debridement down to the muscle layer, while code 11,012 is for debridement down to the bone. Debridement code 11,042 to 11,047 are based on depth and surface area. The primary code represents the depth of the debridement, while the add-on codes accounts for each additional 20 square centimeter of surface area. Primary code 11,042 involves debridement down to the subcutaneous tissue. Primary code 11,043 involves debridement down to the muscle. Primary code 11,044 involves debridement down to bone. When dealing with wound debridement based on depth and surface area, it is important to highlight key points from CPT guidelines given on page number 1330. You don't need to memorize the guidelines, but you should know where to find them. There is a guideline for a procedure involve a single wound, or the procedure involves multiple wounds of the same depth or the different depth. There is also a guideline for a situation where modifier 59 should be used. Now let's focus on an important step: choosing the correct code within a minute. When selecting a code for debridement, the first step is to determine the type of the debridement performed. Whether it is for the dead tissue in the skin based on percentage of the body surface, debridement is for the soft tissue infection, debridement is for an open fracture and or dislocation, or the debridement is based on depth and surface area, which is given in square centimeter. If debridement is based on depth and surface area, remember these coding guidelines. When performing debridement of single wound, report the depth using the deepest level of the tissue removed. For multiple wound, sum the surface area of those wounds that are at same depth. Don't combine sum from different depth in multiple wound. For the debridement of multiple wounds on the same day with different depths, report each procedure separately using modifier 59 along with the appropriate debridement codes. Let's understand each guideline one by one with practice so that you can easily grasp the concept. What CPT code should be assigned for debridement of infected skin covering 16% of body surface area? Option A with the service code 11004, option B with the service code 11000 and 11001, option C with the service code 11000, option D with the service code 11042. Our first step is to determine the type of the debridement performed. In this scenario, we are dealing with the debridement of the dead tissue in the skin based on percentage of the body surface area. Based on type of the debridement performed, we can eliminate option A, which is code 11004 for debridement of soft tissue infection, as well as option D, which is code 11042 for debridement based on depth and surface area. After eliminating option A and D based on type of the debridement performed, we next consider option B and C. Both options are for debridement of dead tissue in the skin based on percentage of the body surface area. In the given scenario, the debridement covers 16% of the body surface area. Code 11000 covers 10% of the body surface area, and we would use the add-on code 11001 for the additional 6%. Based on the percentage of the body surface area, we can eliminate the option C, which is with the code 11000 for 10% of the body surface area. So our correct option is option B with the service code 11000 along with the add-on code 11001. A 30-year-old patient had an abscess near her vulvar date burst. She has developed a soft tissue infection caused by gas gangrene. The area was debrided of necrotic infected tissue. All of the pus was removed and irrigation was performed with a liter of saline until the area was clear and clean. The infected area was completely drained and the wound was gently packed with sterile saline moisturized gauze with pad placed on top. What is the correct CPT code for this procedure? Option A with the service code 11000, option B with the service code 11010, option C with the service code 11004, option D with the service code 11042. Our first step is to determine the type of the debridement performed. In this scenario, we are dealing with the debridement of soft tissue infection. Based on the type of the debridement, we can eliminate option A, which is code 11000 for debridement of dead tissue in the skin based on percentage of the body surface area. We can eliminate option B, which is the code 11010 for debridement of an open fracture or dislocation. We can eliminate option D, which is the code 11042 for debridement based on depth and surface area. After eliminating option A, B, and D based on type of the deployment performed, our correct option is option C, which is code 11004 for deployment of skin, subcutaneous tissue, muscle, and fascia for necrotizing soft tissue infection, external genitalia, and perineum. A motorcyclist is brought to the emergency department after a motor vehicle accident. The physician confirms an open right tibia proximal fracture and perform extensive debridement of gravel, glass, and other debris down and including part of the muscle at the site of the fracture. What CPT code should be assigned for this service? Option A with the service code 11,000, option B with the service code 11,011, option C with the service code 11,012, option D with the service code 11,043. Our first step is to determine the type of the debridement performed. In this scenario, we are dealing with debridement of an open fracture. Based on type of the debridement performed, we can eliminate option A, which is code 11,000 for debridement of dead tissue in the skin based on percentage of the body. We can eliminate option D, which is code 11,043 for the debridement based on depth and surface area. After eliminating option A and D based on type of the debridement performed, we next consider option B and C. Both options are for debridement that include the removal of foreign material at the site of open fracture. Option B with the code 11,011 is for debridement down to the muscle. Option C with the code 11,012 is for debridement down to the bone. In the given scenario, the removal of the foreign material and debridement extend to the muscle only. Therefore, we can eliminate option C, which is for the debridement down to the bone. So, our correct option is option B with the code 11,011, which is for the removal of foreign body at the site of open fracture and debridement that extend to the muscle only. The patient presents with pressure ulcers on both lower extremities. The doctor deprives a 30 square centimeter ulcer on the left calf down to the subcutaneous tissue and a 10 square centimeter ulcer on the left heel, which is also debrided subcutaneously. How should the debridement code be reported? Option A with the service code 11,042 and 11,045. Option B with the service code 11,042 and the service code 11,043 along with modifier 59. Option C with the service code 11,042 again showing the service code 11,042. Option D with the service code 11,042 and the service code 11,044 along with modifier 59. Our first step is to determine the type of the debridement performed. In this scenario, we are dealing with debridement based on depth and surface area. When dealing with this type of debridement, we must remember the coding guidelines. The doctor performed two debridements, one of 30 square centimeter and another of 10 square centimeter, both of which were debrided subcutaneously. This means both debridements were performed at the same level. Based on the coding guidelines, we will first eliminate both options B and D, which show debridement of two different levels. Option C is also eliminated because according to the coding guideline, for debridement done at the same level, the area should be summed together rather than reported separately as indicated in the option C. After eliminating option B, C, and D based on coding guidelines for debridement done at the same level, Our correct option is option A. In this scenario, the total debridement covered a surface area of 40 square centimeter. Code 11042 covers the first 20 square centimeter, and we would use the add-on code 11045 for additional 20 square centimeter of surface area. A physician performs debridement on 4 wounds on the same day. Bone is debrided from a 4 square centimeter heel ulcer and from a 10 centimeter scar ulcer. Subcutaneous tissue is debrided from 16 square centimeter abdominal wound and 10 square centimeter thigh wound. How should the debridement code be reported? Option A with the service code 11044, 11044, 11042 along with modifier 59 and 11045. Option B with the service code 11044, 11042 and 11045 along with modifier 59. Option C with the service code 11044, 11042 along with modifier 59 and 11045. Option D with the service code 11044, 11042 along with modifier 59. Our first step is to determine the type of the debridement performed. In this scenario, we were dealing with the debridement based on depth and surface area. When addressing this type of debridement, we must remember the coding guidelines. The physician performed 4 debridement, 2 at the bone level and 2 were debrided subcutaneously. According to the coding guidelines, for deployment performed at the same level, the areas should be summed together. And then we will code the deployment at different level with modifier 59. Based on the coding guidelines, we first eliminate option A, which shows deployment done at the same level separately. We will also eliminate option B, which includes the add-on code 11045 with modifier 59. Finally, we will eliminate option D, which cover only the first 20 square centimeter of subcutaneous debridement as in the scenario involves more than 20 square centimeter. After eliminating option A, B and D, our correct option is option C. In this scenario, the physician performed 4 debridements, 2 at the bone level and 2 were debrided subcutaneously. The total surface area covered at the bone level is 14 square centimeter, which is addressed by the code 11044, which covers the first 20 square centimeter. The total surface area debrided subcutaneously is 26 square centimeter. Code 11042 covers the first 20 square centimeter, and we would use the add-on code 11045 for the additional 6 square centimeter of the surface area. Modify 59 with the code 11042 indicates that the debridement were performed at the different levels. In the next video, we will cover the practice question related to excision, repair, and adjusted tissue transfer of integumentary system. Thank you for watching. If you have any question or need further clarification, please feel free to write in the comment section. For more detailed guidelines, CPC mock exam related questions and notes, email me at the giving email ID.